Every 40 seconds, someone in the United States has a heart attack, according to the Center for Disease Control and Prevention. This isn't just a statistic, it's a reality that underscores the prevalence and severity of heart disease in our society. Each year, about 805,000 Americans experience a heart attack, and for nearly 3/4 of them, it's their first. That's the equivalent of the entire population of Seattle experiencing a heart attack every single year. Heart disease remains the leading cause of death in the United States, claiming more lives than all forms of cancer combined. Yet despite these staggering figures, the awareness about the signs of a heart attack is surprisingly low. Many of us have a Hollywood-inspired image of what a heart attack looks like: sudden, sharp chest pain, a dramatic collapse. But in reality, the symptoms can often be far more subtle, and sadly, they are frequently ignored. Now, what if I told you that not all heart attacks announce themselves with chest pain and shortness of breath? Let's dive in. 1. Cold sweat and paleness. In fact, up to 30% of individuals who've experienced a heart attack reported having this symptom in the days leading up to the event. However, what distinguishes this from normal sweating is its sudden onset and distinctiveness from the sweat produced during hot weather or physical activity. It feels sticky and cold, often accompanied by a sensation of chilliness on the forehead or throughout the body, and you may notice a sudden paleness in your skin. This symptom can appear intermittently, resolving spontaneously within a few minutes, and it can occur at any time, whether at rest, during meals, or during routine activities. Moreover, it tends to recur before a heart attack. If you observe such cold sweats and paleness, especially if they occur repeatedly, it's crucial to take them seriously. These are not ordinary symptoms and could indicate that your heart is under distress. Seeking prompt medical attention could be vital in preventing a heart attack. 2. Fatigue or shortness of breath. This symptom is critical. A staggering 70% of women who have experienced a heart attack reported feeling fatigued or short of breath in the days or even hours leading up to the event. This fatigue isn't your typical tiredness. It resembles flu-like exhaustion, but without the accompanying cough, fever, or sore throat. Profound weakness or muscle fatigue, especially if it's a recent development within the last 30 days, demands your attention. Pay close heed if you suddenly find yourself short of breath after minor activities like walking a block or climbing stairs, or if you're experiencing an unusual level of exhaustion disproportionate to your exertion. These signs could indicate clogged arteries, a precursor to a heart attack. Even without chest pain, deciphering whether your shortness of breath or fatigue stems from heart issues or other factors like anemia, bronchitis, or simply a lack of physical activity can be confounding. 2 critical indicators suggest your symptoms may be heart-related: a recent and notable increase in symptoms, especially if they are new or have worsened recently, and the presence of heart disease risk factors. The combination of symptoms and your personal health history paints the full picture. 3. Jaw pain. Pain in the jaw, particularly on the left side, could serve as a potential indicator of a heart problem, potentially signaling an impending heart attack. This occurrence stems from the intricate wiring of our bodies during fetal development, where organs form with nerves originating from various parts of the body. Consequently, as adults, our brain may occasionally misinterpret the source of pain. Therefore, experiencing unusual or persistent jaw pain, especially if localized on the left side, warrants careful consideration as a potential warning sign. It's crucial to recognize that while jaw pain can have multiple origins, its correlation with other symptoms of a heart attack or the presence of risk factors should not be disregarded. Prioritizing caution, individuals experiencing such symptoms should promptly seek evaluation by a cardiologist, particularly if accompanied by additional warning signs. 4. Gastrointestinal discomfort. This symptom is notably prevalent among women and the elderly, presenting more than just typical stomach pain. It's a sensation that may mimic gastritis, but with distinct characteristics. Individuals may observe stomach bloating, particularly following meals, along with discomfort during physical activities like walking or exertion. It's essential to recognize that these manifestations might not solely stem from gastrointestinal issues, but could indicate underlying cardiac concerns, especially for those falling into high-risk categories for atherosclerosis. such as individuals over 50 or those with comorbidities like diabetes, hypertension, obesity, particularly with excess visceral fat, smoking habits, or regular exposure to secondhand smoke. If you resonate with these experiences, particularly bearing the mentioned risk factors, it's crucial not to disregard these signals. They could serve as early warnings from your body about a potential heart attack. Timely detection could prove instrumental in safeguarding your heart and potentially your life. 5. Back pain, particularly around the scapula or lower part of the neck, especially on the left side, can serve as a precursor to a heart attack or indicate a problem with the aorta artery, one of the largest arteries in the body. While it may be tempting to attribute such pain to muscle strain, it's important to exercise caution. If the pain persists despite changes in position or attempts at self-massage, it could be a sign of a more serious underlying issue. Unlike typical muscle soreness, this type of pain tends to be relentless and unresponsive to conventional remedies. The aorta, responsible for distributing blood to nearly all parts of the body, can develop ulcers or tears due to certain diseases, resulting in intense pain between the shoulders. If you experience a new symptom of back pain that doesn't alleviate with usual treatments, it's essential to consider the possibility of a heart or aortic problem. The nature of the pain associated with these issues is distinct and severe. In the case of aortic problems, the pain is often described as intense, as if something is penetrating from the front of the chest straight through to the back. However, when the pain is linked to a potential heart attack, it tends to be milder but still significant, manifesting as persistent pressure in the back. This pressure-like sensation is typically intermittent, occurring for a few minutes at a time. If you experience this type of back pain, particularly if it's new or unusual, it could be your body's way of signaling a serious condition. 6. Numbness of the left hand and arm, especially during activities like walking or climbing stairs, warrants attention, particularly if it's a recent occurrence. While various health issues can lead to such numbness, it's essential to assess the context, especially if you have known risk factors for heart disease. If you've experienced this symptom recently and cannot attribute it to any other logical cause, it's crucial to take action. Consulting a cardiologist, especially if you're at risk for heart problems, could be a vital step in ensuring your well-being. Dizziness. Dizziness can be a concerning symptom, especially if it occurs suddenly or during activities like walking, climbing stairs, or eating. If you've recently experienced feelings of faintness or low blood pressure without an apparent cause, it's essential not to ignore them. Many patients with significant heart issues report experiencing such symptoms, prompting further diagnostic procedures like cardiac catheterization. This procedure, involving the administration of contrast to visualize the coronary arteries, often unveils nearly complete obstructions, highlighting the importance of addressing these symptoms promptly. Lastly, an irregular heartbeat. Your heart usually beats in a regular rhythm, but if you're noticing frequent skipped beats or a rapid heartbeat even when you're relaxed, it could be a sign of a silent heart attack. It's important to remember that while palpitations can be caused by many things, they shouldn't be ignored if they're frequent or unexplained. As you see, these signs can easily be mistaken for minor health issues. Awareness is the first step, but what do you do when you notice these signs? If you've been musing over this question, you're not alone. The answer is indeed straightforward. It's about taking action. Don't brush aside the signs as simple fatigue or just stress. These minor symptoms might be silent indicators that your heart is communicating, and it's important to listen. It's to seek immediate medical attention when you notice any of these signs. Don't postpone, waiting for the symptoms to intensify or for a severe heart attack to strike. Dealing with heart health requires a sense of urgency. Every ticking second can make a significant difference. If you're worried about having a heart attack, don't hesitate to dial your local emergency number or rush to the nearest emergency room. Regular health checkups are essential to stay on top of your heart's health. By consistently visiting your healthcare provider, you can identify potential issues at their early stages and manage them before they turn into grave problems. It's a great measure to keep track of your overall health and ensure you're in optimal shape. Another crucial step in taking action is living a heart-healthy lifestyle. This involves embracing a balanced diet abundant in fruits, vegetables, lean proteins, and whole grain. If you're dealing with obesity, prioritize weight loss. Leave the chair behind and embrace physical activity. Also ensure you're getting quality sleep. Aim for 7 to 8 hours per night. Aim for at least 30 minutes of moderate exercise most days of the week. The type of activity doesn't matter, be it a brisk walk, a bicycle ride, or even dancing. Furthermore, it is essential to manage your stress levels. Over time, high stress can negatively impact your heart health, so it's to find healthy ways to relax and unwind. This could be through meditation or yoga, or simply spending time with those you love. Remember, it's always better to be safe than sorry. Your heart health is in your hands. Understanding the signs is the first step, but taking action is what truly leads to a significant change. Therefore, don't wait. Start taking the necessary steps to protect your heart today. It all starts with awareness and understanding the signs, but taking action is what truly makes the difference. So don't wait. Take the steps needed to protect your heart today.